Hello again. I'm going to try to get to most of the questions that we didn't get to during the session. There are several questions about certification. The Erickson Foundation does not do certification. The only legitimate certification in the United States, and you can get certified from outside of the United States too if you're a member, is the American Society of Clinical Hypnosis. And you go to their website. It's a 60-hour training. You have to take some training from them, but they are the only legitimate ones. So if you see other certifications, they're not really legitimate. There's another question about why the Erickson Foundation, ASCH ASCH does accept training from us. They do accept training hours from us, but you have to also have ASCH. So you can't get all of your hours from us for ASCH certification. But for instance, is this the 20 hours? Is this 20 hours that they just did for A or B? Or anyway, the hours that you have from this training will qualify toward ASCH certification, but you have to also have ASCH hours. There's a question about whether the teachers offer individualized sessions. Yes, you would just have to contact us individually. You can do that through the foundation. I don't know of any book that talks about the usefulness of different inductions or different techniques with certain clinical populations. Something like arm levitation, is a general sort of technique, and then you're just applying it for a particular reason with a particular patient. So I don't think you can say that something like arm levitation or even age regression is better for depressed patients or anxious patients. And if somebody's saying that, I'm not aware of a book that does say that. There's a question about an example. I said something about at some point in the process of therapy with narcissistic personality disorder, you want to use confrontation. An example would be like in using indirection, like in a story, somebody gets confronted, like somebody's doing something, they're treating people badly, they're a bad boss or something like that. And somebody gets up the courage and goes and tells the boss and says, I want to tell you this because I think you're a good person, but some of the other employees are pretty dissatisfied. So I would do it indirectly like that and let the person take the meaning for themselves. If you want to get even more indirect, you could do something like with animals. So there's an animal that isn't doing something, and the other animals go and confront. So it depends on how indirect you want to get, and with some narcissistic patients, they're very touchy, so you want to get quite indirect. But that was what I was thinking, is to use indirection with them. Do it within a story, so you're not aiming it at them. It's in a story, but they can take the meaning of the confrontation in their own way. Can one hide occasional conversation induction in a psychotherapeutic setting? You can. It's not my preference. I am pretty strict about informed consent, and I think if I'm going to use hypnosis in any form or fashion, the patient should know about that. But there are people that have different ideas about that, so I'm not the be-all, end-all in terms of an opinion about that. But I don't do that, except for like the little 2 or 3 minute things, and I'm not thinking about that as formal. Just if a person has an idea, say, let's focus on that for a moment. I'm not really thinking about that as hypnosis. If I'm doing hypnosis, I get informed consent from the person, and if I don't want to do that, I just have a positive hallucination of myself sometime in the future sitting across the table from a lawyer, and the lawyer said, Dr. Geary, did you tell your patient that you were using hypnosis? And I would say, no, I don't think I would want to be in that situation. And then there's some other questions in here about conversational induction. I don't do them, so I think maybe Lillian does a little bit of that, so maybe direct a question to Lillian about conversational induction. Okay, one question. Since I am against saying go deeper, since I don't believe in deeper trance, Is it still okay to use the word deep or deeper? I use that word with relaxation. Deeply relaxed, getting more deeply relaxed. I do use that, but I always use the term deep with relax, because there is such a thing as deep relaxation. I just don't think there's such a thing as deep hypnosis. So yes, I do use the term, because a lot of people think, a lot of lay people think about deep, you're going deeper and deeper, that kind of thing. So you can utilize it, sure. And you also don't have to necessarily agree with my opinion that there's no such thing as deep trance. Again, I'm not the god of hypnosis. Okay, then there's one thing here. A person asked about recording sessions. I think you misunderstood, and I wasn't clear enough. You don't record the whole session once the person walks in. You're only recording the hypnosis for them to listen to. So I don't record what we do before the hypnosis. It's, okay, now we're ready to do the hypnosis. Get in a nice, comfortable position. That's when the recording starts. And then it stops when the person reorients from trance. So I don't record the whole session because the person pointed out that there could be a danger if you were asking about or discussing kind of traumatic sorts of issues, that they could get back into that when they're not in your office. So no, that's contraindicated. I'm only talking about the hypnosis. I only record the hypnosis. Then there's a question about auditory hallucinations. And basically the essence is he's working with a patient who loves hypnosis, but he doesn't want a different relationship with the hallucinations. He wants them to go away. And I would say that that's not a realistic expectation. So it's a little bit like if a person has had a brain injury and they don't recollect something, they have amnesia, say they have retrograde amnesia for an automobile accident and they want to remember. That's organic, and you don't do something organic, retrieve something organically lost with hypnosis. And just in the same fashion, I don't think you can stop auditory hallucinations with hypnosis. Otherwise, all psychiatrists would be using hypnosis and they wouldn't be giving quetiapine. There's a question in here about depotentiating the conscious set. That's, I think, Steve Langton, so you'd have to ask him. I don't know anything about that. Typical program of hypnotherapy. Yes, it is highly variable. When people call me and say, how many sessions will this be? I'm a brief therapist, so I don't know if you're a brief therapist or not, but I say you have a 90% probability of seeing me somewhere between 2 and 10 sessions. So that's how I work, and I am a brief therapist. I don't do long-term therapy, and if it comes up that they really need long-term therapy, fortunately I have some colleagues to whom I can refer. So my typical course is 2 to 10 sessions for people. And my idea about having these kind of general standalone recordings of hypnosis, people do it. I don't think there's anything necessarily wrong with it. They're usually pretty general. They're not targeted, they're not individualized, and if people can listen to them and take their own meaning from it, I think that's fine. But I don't make just recordings that I stack up in my office and sell for $19.99 or anything like that. So I've never done that. I know people who do it. I don't have any particular objections to doing it. If it gets a person listen to hypnosis and then they go see a therapist because they like hypnosis, then I think it can be valuable. But the disadvantage is that they're not personalized, they're not individualized to a particular person. Hypnotically informed psychotherapy, like conversation. Oh, okay. This is kind of complicated. Since we're trying to activate the nonverbal areas of the brain to get it to search for associations and resources nonlinearly, which I don't necessarily agree with, but what can you say about trying to speak in a non-grammatical, less linear way that would be difficult to understand by the usual language, but would be filled with suggestions and metaphors? I don't know. That's not what I'm after, so I really can't answer that question because I've never tried that or really thought about doing that. How can you help a patient in hypnosis to stay focused? Well, One way is to keep them interested. Another way is to do hypnosis, because you can't do hypnosis without being focused. You can make it interactional, and if they know that they need to focus to respond to questions or an interaction with you, that will keep them focused too. You can talk to them about different parts of their body and focus in on the sensations, for instance, in their feet, so they're focused on their feet, or shoulders or nose, or, it doesn't have to be the feet. So sometimes just by drawing attention to something, but if you make it interactional, that can increase focus too, because they know that they have to respond to you, so stay focused in that way. How would you approach grief and loss issues? Again, this is huge. The grief and bereavement, loss, people with whom I've worked through the years, it's often kind of a thing about, and this isn't how it sounds, but life goes on. Your life is going to go on. You've had a loss, but you have a future as well. And so we address the loss and the feelings surrounding that and things like that, but I often pretty quickly turn my attention to the future. And it's not to devalue the loss at all, it's just that you have to go on. And if it's a parent or if it's a loved one, that person would want you to go on. And so let's pay attention and start to plan and think about what it is that you're going to do with the rest of your life. Now, that's not what I do in the first session. And again, there are things to discuss and emotions to process and things like this with the loss that I would certainly do before I would make that switch. And I would do that gently. But that's really kind of the point of a person coming to therapy, is to, quote, get over or, incorporate into their being the loss so that it doesn't interfere with their ability to move forward in life. Okay, there's one in here about if a person in coaching can use hypnosis. I think absolutely you can, because your focus, the examples are, a better diet or how to just do things more practically in life. Sure, you can do that, absolutely. Keep it in the realm of coaching. Don't do psychotherapy. Keep it in the realm of coaching. If you're not a psychotherapist, don't do psychotherapy. And I'm not a coach, so I don't do coaching. So, keep that boundary there. But can you use hypnosis in coaching for people to live their lives better? Absolutely. Sure you can. Okay, in Peru, typically the sessions aren't recorded. Is a copy given to the patient? Yes, absolutely. Again, it can be on their phone. It can be that you record it and download it and send it to them. Also, there was something about informed consent or HIPAA in this. If you don't say the person's name, then if anybody gets a hold of the recording, they don't know who the recording's for. So I don't have any HIPAA concerns or confidentiality concerns if I'm making a hypnosis recording and somebody hacks it or something like that. But it's the patient's responsibility to protect it. It's not my, once it's in their possession, it's their possession, and it's not up to me to protect it. If they want to play it to somebody else, that's their business, and that's out of my hands. But yes, the person needs to have the recording to listen to on their own. So absolutely, the recording is given to the patient, yes. And how long does it take to get certified? You go to ASCH, and again, it's 60 hours. You can do it reasonably, like within a year, I think. You could probably complete the certification within a year. You have to have a learning contract, and then the final portion is you work with approved consultants. You take a basic and an intermediate workshop. But I think you can do it within a year. But you can get much more information from ASCH off their website or by calling them directly. Oh, there's a question about the type of seat. Should you use a firm seat? People will have a tendency sometimes to fall asleep. So my chair is kind of in between. Some people use these recliners, and the person's sitting back, and I think that's real high probability to go to sleep. So mine's kind of medium. It's not uncomfortable, but it's not something that you sit down in and want to go to sleep. So you want the person to be able to stay awake. But you want also, of course, want them comfortable. Now, in the hypnosis, they're only going to be in it for 20 minutes. So, you can have something that is moderately comfortable, and that's another good way to keep them focused so that they're not going to sleep. Okay. I think I got to most of them. If I didn't, you can feel free to email me. You can email me through the foundation, or I think I gave my email at some point. But again, it's BRENT@GEARYBB.com. So feel free to, if I didn't answer your question, it's not that I devalued your question, it's just that I must have overlooked it or something. I tried to combine some of the questions about certification thing. But feel free to email me. Just put something in the subject line about Erickson Foundation training or something like that so that I know it's safe to open. So thank you. I look forward to seeing you in the future.